Just a moment.
Yeah.
So we'll be live in 3, 2, 1. So good evening, everybody, and welcome to this another episode of Wednesday Musings with Borate sir. And today we have a very interesting topic on effective use of social media platforms by orthopedic surgeons. So I'm sure this will be a very interesting 1 hour discussion that will go on. And for further proceedings, I'll hand it over to Dr. Tarang, who is a convener. So over to you, sir.
Yeah, thank you, sir. Welcome, everyone. Welcome, Dr. Borate, sir. And let's say this is our nth meet on Wednesday Musings, and the response which we have got and the way we have continued is a testimony in itself that social media plays a pivotal role in today's world. And so today's bringing us back to today's topic, the effective use of social media. Let's say not just effective, but effective, judicious, and very much ethical use of social media in orthopedic practice. We'll be discussing in detail. It's a very untouched and a virgin topic by not just orthopedicians, but totally all of the medical fraternity itself. So, Borate sir, I'm pretty sure that the young generation is aware of social media. But can you just segregate between these social media websites and the social media apps like Facebook, Instagrams, and let's start with that. Let's start with segregation first, because it is all vague right now. Use of social media and using n number of apps, it is all vague and haphazard.
Yeah, see, the thing is that this whole social media initially was thought or started as a let's say entertainment or a tool for people to meet and keep in touch with each other online. The potential for this social media as a technology tool in various fields was not the original intention when it was started. It was started as basically an online mechanism for people to connect to each other without physically meeting. So I think that it has very quickly, just like the internet itself, has become a it has grown very fast and it has made a big impact. In the same way, this social media has grown faster than one would have imagined. And now it's become a completely different thing from what it was. I mean, it's still doing all the things that it was started off to do, but it's now become a different thing altogether. So one has to look at it in that context, I think.
Yes, absolutely. So it is like wherever you have the viewership, you market yourself or you project your work. And most of the time, an idle time of an average individual is spent on his phone, on his social media network. So
Yes.
it is such a wonderful, you can use it as an asset as well to grow your business.
Yeah.
Right. So what are the various podiums on through which one can market himself or showcase his work, sir?
See, I think that it is important to understand that the social media, if you want to use it as a marketing tool or to promote yourself or your practice, one has to be interested in it, and one has to be willing to take the time required to learn about it and see how it is used by other people, so that one can then formulate a strategy and effectively use it. So if you want to use it in practice, then you have to create a strategy First of all, that means that you must have a website of your own, which you will put out all the information that you want people to have, those who are interested in, using your expertise. So that is the first step. And then, you have to decide what aspect of your expertise you want people to know about, and create what is known as a content calendar, so that you can put regular information about your work every month. So, like if you're a pediatric uh, orthopedic specialist, so you'll have to, if you prepare like every month, you'll put one interesting case that you have done, and then give some information to patients who children may have this problem. Then, if you have this content ready for a year or so, and you have worked at it before, then it will be useful, because then that content will appear constantly and keep changing. You also have to make sure that whatever you put out is not contradictory or not haphazard. So if you are promoting yourself on multiple social media, then you must use each of those avenues in the way they are useful. Like, for example, in Facebook, you could promote your skill as a surgeon by posting some information relating to that. So it all depends on what you want to do. And for example, Google, you can ask your patients to write reviews about those who have been treated by you. And on Twitter, you can project yourself as someone who leads discussions in on a particular topic, or makes intelligent comments on certain topics and so on. So all that requires first of all, knowledge and understanding of the media, because there are many experts who are willing to give you all the knowledge for a fee. But that is not a good way to do business. It is necessary for you to know yourself, and necessary for you to get involved in the whole process, without which you will not be very effective. And there is another problem when you are active in social media, is to not confuse your personal account with your professional account. So if you're projecting yourself as a professional, that is a completely different world. And if you are on a social media site as a on a personal capacity, then that is a completely different world. And you must take a lot of effort to keep these two things apart. I am of the opinion that if you are a professional who's promoting himself, then your personal site also should be extremely um, uh, non-controversial, and not full of material that is provocative or anything like that. You should make sure of that, because otherwise, that is something that you can get into problems as a professional. Another problem, and I don't have an answer for this, is that what happens if you make friends with somebody on your personal account who also happens to be your patient? I mean, you don't know that, but subsequently that person turns out to be your patient, and or he or she becomes your patient. So these are issues which are overlapping, and there is no real uh, you know answers at this point of time. But I think that if used judiciously, used diplomatically, and used honestly, rather than use it, in a predatory manner. See, most of the problems that are there on the internet is because of the relative anonymity that people get. They tend to become caricatures of themselves. They tend to misuse the medium by in various ways. So if your intentions are clear and you're careful, you need not worry about the potential pitfalls that are there. There are many professional companies that will help you with the marketing, but as I said, it's better to go slow, understand what is happening, find out what other people are posting, and so on. And that's what you should be doing. Hello. Hello, can you
Yes,
hear
sir.
me?
Yes, sir. Yeah.
Yeah.
Yeah, absolutely right, sir. I totally agree, and very valid points made by Borate sir here, especially the ones that you have to keep your personal and professional accounts separate. And even if you are promoting your professional account, your private account needs to be non-controversial, non-provocative. So, speaking about social media, and you also mentioned about how Twitter could help, or how Facebook could help, or how YouTube could help. Can we go in detail and talk about the online social network and virtual health community? Now, if we divide our talk into two parts.
Yeah.
So can we speak on first on the online social network? That could be probably Facebook, obviously, Twitter, YouTube, Google, and later probably we'll go ahead with the virtual health community.
Yeah, okay. Now, the online social networks, particularly Facebook and many others that are there. Facebook has been around for a long time, and
Yes.
it is probably the most popular site. But what I find is that its use among doctors is still much less. It's only about 15% doctors they have found using it, and relatively very few people are using the B pages or B groups, which allow you promotion of your business, so to speak.
Right. Okay.
Yeah.
And then there is always a downside for Facebook. Like you said, a patient sends you a friend request,
Yeah.
and the doctor is in a dilemma whether to accept it or not.
Yeah.
Yeah, true. And then any specific views on the Twitter, sir?
See, Twitter has um, primarily to share information. You could use Twitter and particularly to give certain information that.
Certain announcements and probably Facebook is more detailed version. We can say we can use Facebook as a more detailed version to actually showcase what your good work is. And Twitter, with the limitation of characters, you have just you can just make announcements, something or sort of.
Yeah.
Right. So, your thoughts on the other social media channels like YouTube, probably, because we are, or Instagram, for that matter.
Yeah, well, YouTube is a very much more popular for posting videos and information by doctors. But the problem is that the overall research has shown that Facebook also offers advertising, Facebook also offers promotion. But by and large, whatever material that has been there has been studied, the overall quality is low and the information is very uh, unreliable. For example, somebody did a study on the information available on uh, femoroacetabular impingement on YouTube. Okay. So they found that there were large number of videos. There were abundance of videos on femoroacetabular impingement. When they studied all those videos, they found that 19% were absolutely not at all useful, 55% were okay, and 21% as moderately useful. So that is what they found. And there is also the potential to find misleading information contradictory to practice standards, because there is no control over the content by any government or any kind of authority.
Right.
Those videos that are put up by government agencies or professional associations, they were found to be better than those put out by private individuals.
Private individuals.
Yeah. So the utility of YouTube as a patient education tool is pretty high, but it has to be more. The content has to come from reliable sources.
Reliable and expert sources, probably it has to be really precise and useful. Absolutely. So when YouTube content is tailored and it is generated by expert and then promoted, its utility improves probably. So
Yeah.
your views on blogs, sir? Video blogs. Now recently, people have started vlogs, what you call, that is video blogging also. So that is, we are not even coming close to blogs.
Blogs.
Yes.
Blogs are a very good way of putting information
Right.
that you want to share, which will be useful and maybe in the form of a opinion or an explanation or information about a subject that you have kind of collected from various sources and so on. The usefulness of a blog depends on how you evolve and how you create a credibility about the information you are putting out on your blog. So, usually what happens is that if patients want to seek medical treatment from somebody, so there's a patient in Pune who is like wants to see an orthopedic surgeon. Now, when he puts that person's name on the internet, he will, if that person already has a blog, then that blog, he will get a link to that blog. Now, when he goes to the blog and if he gets information about who is that person, what he does, and so on and so forth, then it will help him. And the other side is that if a patient calls you and says, I would like to come and see you and I have this problem, my child has club foot problem. I'd like to show him to you. So if you could tell that person that, look, you're welcome and you can give him an appointment for a certain day. But if you tell him that I'm going to send you a link to my blog on which I have put certain information about clubfoot, which you will find useful to read before you come to see me. Okay.
Right.
And now on that blog, you will have information. So if a patient comes after reading all that information, a lot of time is saved in your giving that information again. The second thing is that if on the blog you have information about how this thing is treated and what are the precautions after every intervention or different kinds of interventions, then a lot of time is saved of yours as well as the patient's, because he can go back to the blog and read all that information. He can follow the information and access it repeatedly if he wants. So potentially it is an extension of yourself as a counseling and providing information without physically being involved all the time. Because one of the problems that doctors have is limitation of time, how much they can talk to the patient. So a blog gives you an opportunity of creating your own identity as well as creating source of information that you yourself have curated. And so you're quite confident that that will be useful to the patient. And it also remains an evidence that you provided information to the patient.
Yes, absolutely. Yeah,
Yeah.
and for example, the Ponseti cast regularly is to be done in a child, and how to remove the cast is a task for the parents. So
Yeah.
one of my colleagues has made a video on the cast removal, on easy cast removal. So that helps a lot. Absolutely. And anyways, I think before coming down to a physician, these days an educated patient or educated population who are active on social media, they do Google the symptoms and uh, get an idea. So rather than just giving them some false links or not so reliable links, if you have a blog of yourself which is giving them some idea about the ailment, it is definitely a win-win situation for the patient and the attending physician as well.
Yeah.
Yeah. So that was about the blogs. So now, sir, if suppose someone is using a blog and or suppose someone is using a social YouTube.
Yeah.
So what are the norms you feel or ethically and confidentiality, patient confidentiality? What about that? How that can be maintained? Are there any governing rules yet? I don't think so there are. But then if you are using a patient, if you're using a dummy patient, that's still fine, I suppose. But if you are if you end up using a real patient on your YouTube videos or anyway, so do you have to have a consent?
Nowadays, if you are treating any patient and if you want to use his information, it is always better to take a consent of the patient and keep it on record. And in that, you can mention that ask the patient's permission to use his case in a confidential manner without disclosing identity or anything for scientific purposes to provide information at conferences and so on and so forth and in the public forum. So it's always advisable not to put anything on any public platform without a consent to back it up. Okay. Now, the double AOS is also recommending that in your public platforms and blogs, always use fictionalized patients. That means you can use a patient's information, but the name of the patient will be something different and the composite will different. So it will not be possible for anybody to identify the patient in any way, in the way the account has been put out in the public platform. So this is always better to protect yourself, even if you have taken consent. So that is what is recommended. And so as a strategy, I would say that you can use um, videos and images. Like suppose you want to demonstrate shoulder movements or like knee movements or whatever it is. You, as long as there is no individual that is shown and this is just shown as a imaginary patient or you can always do that. You don't need to actually put information about a given patient. And by being careful and being extremely um, um, sure that you're not in any way directly or indirectly uh, disclosing the identity of anyone, that is very important. And in any case, you must remember that even if some information has been removed from the site, it will still remain in cyberspace. So that's why you have to be very, very careful about the information that you put out. In a general sense, don't be extremely careless and casual about information that you put, even about yourself, Um, that is very important because a lot of problems that one sees are because of indiscriminate posting and putting up of information about themselves and about each other that has led to a lot of problems on the social media. See, right now, there is no legal framework because the global media is global. So the internet is global. So even if India has some rules about it, it is not relevant because they may not apply in other countries. Unless we have a global understanding and a global consensus on actions relating to certain wrongdoings by users of the media, it is going to be very difficult. So, comes to mind is that you are going to do all this, but are you going to make any money out of it? Are you going to be compensated for it? But how is in terms of compensation? One should look at it in the way that if I am a good doctor and I want people to know about me, in the old days, it was only my patients whom I had treated who were my real ambassadors. Now I have a medium or a mechanism which is available to me without spending a large amount of money to make myself available to whoever is interested in knowing about me. So it is a good, it is an ethical way of promoting yourself. And there is no harm in doing it if one does it carefully. And if one spends a certain amount on a regular basis, on a daily basis, one will get comfortable with it. And one will get familiar with it. And one will get familiar with it.
Can
And
you
one will
pause
get
for a minute,
better
sir?
at it.
Your voice is
Yeah.
breaking.
Hello.
Can
Yeah.
you pause for a minute? Your voice is breaking.
Sure. Hear me now.
Yes, sir. Yes, sir.
So
Yeah.
it is something that whoever wants to use social media platform as a tool for improving his practice or his reputation has to be willing to first of all learn and become familiar with these mediums, then be willing to spend half an hour to an hour every day in supervising and looking and revising and modifying content and answering questions and so on and so forth. So if you do it regularly, then it is in the long run, you'll get used to it, you'll get comfortable with it, and you will start enjoying it. On the other hand, if you don't want to spend time, there are other people who are willing to do it for money. There are websites, there are service providers who will give you everything that you want. They'll even write articles for you, they'll do whatever you want. But the thing is that that is not the correct way of using it as a medium. You have to be comfortable with it and you have to be familiar with it and you have to develop the skills to use that medium comfortably. So without that, just having a presence on social media is not going to be of any use. And there is going to be a certain amount of cost involved. Although if you are personally involved in putting on all the material and you are willing to give your time, then the cost is not very high.
Absolutely, sir. Like you mentioned, previously in the olden days, you had probably relatively less number of a small amount of patients who would promote you as a word of mouth publicity through a word of mouth publicity.
Yeah.
But today, there are multiple mouths in terms of social media. And like I remember, I just came across a quote by, I think, Jeff Bezos or someone, an online reseller, a big man. I don't remember actually. So it goes something like, if you make a client happy in the physical world, they might tell their 6 friends. But if you do that on the internet, they are supposed to tell this to their 6,000 friends. So that investment of that much of time in writing a blog or articles or making videos, at some point in time, on a longer run, it will definitely fetch good results.
See, there are two things that I would like to caution on this. Is that potentially, although a lot of people may know about you across the world, but if you're practicing in Pune and somebody from Venezuela learns that you're a good surgeon, it is not really going to be translated into your getting more work and more money. So, although this multiplying factor is there, um, it is not really that useful as the information that is usable. How many people out of these 6,000
Right.
are in your vicinity and are going to
No,
use that?
absolutely. Those 6,000 are not as loyal as those 6 people, perhaps handful of people you are meeting.
Yeah, so the difference is not that large as one might think. Then there is another problem that you have to understand. That, for example, there was a study done on YouTube videos. So when they typed in the word arthritis on YouTube, the number of videos that appeared were 45,700 videos. If you're one of those, the chances that you will be seen by somebody are relatively not all that great. When somebody typed in the word orthopedic surgeon, they got 4,360 videos. And when the word total joint replacement was typed, there were 1,090 videos. This is research done in 2011. So in 2021, I can only imagine how much these figures must have grown, So the thing is to understand that when you put yourself onto a platform which is for the general public, then the utility of your expertise is not as great as when you put it on a professional platform or in a group of orthopedic surgeons or a group of orthopedic students or whatever, because then there will be a qualitative difference in the audience and people will understand and you can put what you want to say, which is which will be understood and appreciated by your audience. So that is why these virtual health communities are a completely new way of projecting yourself. See, in the old days, if you were a teacher in a medical college, your students came to know you and your reputation was enhanced. But if you went to conferences, people came to know that you are somebody. So your reputation was enhanced. So the process of creating a stature and reputation was a long drawn out process, and which only a certain amount of time and certain positions and certain opportunities were required for you to grow, in stature. Now, with these internet virtual health communities, you know what you're saying, and if you are willing to work, then there is a potential for you to put out information. And that information is likely or potentially not prevented from reaching people. So previously, unless your article was published in JBJS, you did not have stature. But now, you see, you are accessible to the entire orthopedic community in the world in various groups. And if you post content on, see, and in the old days, with journals, there was a question of cost, was a question of money. Now, with everything online content and virtual content, costs have come down. And so the potential for you're being accepted in a professional peer group and whatever you want to put out being accepted, provided the content is good, is much higher now. And your popularity or your reputation is only limited by how much hard work you do and how much understanding and of the subject you are able to demonstrate. So it is it has leveled the playing field in favor. In the old days, it was a very old boy type of network. So if your professor said you write an article and he would get it published. So unless you had the right connections and you had the right people who gave you a kind of push, you didn't go far. Now all that is out of the window. And if you are good and if you can demonstrate it, you are going to be in contention. That is what is the power of the virtual world. Another thing I want to talk about is there is a lot of misunderstanding among doctors about patients who use the internet. Doctors generally think he wants to get technical information in order to impress the doctor or generally ask uncomfortable questions to the doctor. So in general, doctors are not very comfortable. Patients who have come prepared by reading whatever is available in the public platform about whatever problem they think they have. But there's been a lot of study on this on patients. And one thing is clear, that even today, patients still consider doctors as the most important source of health information. And online information is seen as a complement to opinions delivered by doctors. So that is clear. Ki patient, however much they may read, they still are very clear that the doctor's opinion is the most important. So then why do they want to have this information? The simple thing is that it makes them feel better. It makes them feel more comfortable because now they know about something. So as the world becomes more complex, people are happy if they have information. Like if you are flying on an airport, in an airplane from point A to B, you're not comfortable unless you know what time your flight departs, what time it arrives, and how much time you will take how early you have to get in, what are the formalities. Now, all this kind of information is standard information. And once you get that information and once you travel more than once, then you become more and more comfortable. So people have now got used to the idea that whatever they do in life, they want to be armed with knowledge and they want to be armed with information. And in the health field, what happens is that they get to meet the doctor for a very short time. They get to get information in a very limited manner. And they sometimes remain unhappy or they feel that they need more time and more information. So if they can have access to that information before they meet the doctor, it only makes them feel better and more comfortable with whatever they want to ask. The second thing is that we must understand that the doctor should not feel challenged when patients come with information. They should see it as an attempt to work with the physician. They should respond positively. So if somebody comes to you and says, I know a lot about CTV and I know about Sancheti, what is the harm? Because he is not your competitor. He has studied Sancheti only because his child has CTV. So the fact that he knows a lot about it should actually make you feel good. And you can now treat him as a friend who is knowledgeable rather than a patient who is anxious. Because he will understand what you're talking. And in the process, suppose there are some issues that crop up in the treatment that you need to explain. He will probably be able to understand it much better than somebody who comes with the idea that I don't care about information. You are the doctor, you make my patient all right. And if there is some problem, then you are responsible. So one should always look at the internet savvy patient as a better patient to handle than a person with less information. And you must also understand, like you said about somebody putting up a video of removing plasters. In the same way, now, if you take osteoarthritis of the hip and a patient undergoing hip replacement, now there are so many rehabilitation information. There is so much questions that patients have about when they should start doing what, how they should access the toilet, how they should create, um, you know, supports which will help them to reduce the stress on the joint when they are moving about in the house. Now, if all that information is put on your blog or your website, including photos, including videos, then what is the harm? A patient, how much, whatever more information they will have, the better it is for them to use that information effectively and efficiently. So, um, the I think that there is a lot of positive aspects. Now, there are some issues. The issues are that patients may get overloaded with information and therefore confused and more anxious than when they did not have any information. So that is one problem that you may have in a few patients. The second problem is that information is available other than what you are putting out. And that information, there is no standard, there is no censorship, there is no liability. So a wide range of information is put out, which may be contradictory to what you are putting out. So that is something that you have to live with and deal with. Then one big problem of the internet or the virtual uh, uh, field is that you are giving information and advice without knowing the individual patient. You see, so once you know the patient, once you have seen the patient, and then you direct the patient to a source of information with these are the things you should access, is a much better way than if somebody just asks you that my child has CTV and you say, go to my blog and read everything about it because you don't know what kind of CTV he has. So that is something that we must understand, that we must not forget that you may read, you may advise your patients to read, but you have to tell them to be careful because what exactly your child has and what exactly he needs will only be possible for you to tell after you have actually studied his problem. We need at some point a global regulation and global standards and so on. And we must understand that legally, we are not allowed to share data which is confidential about our practice and our patients on such platforms. And we can use the data only for treatment of our patients, for payment, information regarding payments, and healthcare related operations. So we had to be very, very uh, careful that we don't use the data that we possess on our patients uh, casually and carelessly on the internet. So once we understand all this, I think that it is a very, very effective tool to make yourself more appreciated and more effective as a healthcare provider.
Right, sir. Yeah, I absolutely agree with the point that if a patient is information savvy, he is more receptive and less anxious, and it makes the job a little bit easier, if not much. So, your views on the use of social media, or rather the use of, let's say, YouTube for mentoring, for teaching. How do you perceive that?
Yeah, I think that is one aspect that has enormous promise. It is a huge game changer according to me. That see, I'm not looking at social media as such. I'm looking at the technology that social media has unleashed or opened up. And that technology is really, really very useful in training people, in nurturing people, and making them confident about their practice and their approach to patients. So, like for example, somebody who is a medical student, if he has interest in orthopedics, now I'll give you an example. When I was in second MBBS or when I was a medical student, one of my lecturers was a general orthopedic surgeon who was very interested in orthopedics. And somehow he uh, took a liking to me. And I don't know if you might knowing him also, Dr. Agarwal. He's no more. But he used to call me uh, to see operations in orthopedics that he used to do in the afternoons at Solapur Civil Hospital. So I was very fond of, so that is where even while I was a medical student, I got interested in orthopedics because somebody mentored me. Somebody said, "Arey, ye acha hai, you come and see this and you'll enjoy it." So somebody who's interested in whether I should go into general surgery or neurosurgery or pediatric surgery, if he looks at somebody in that already in that field and that person just shares information that will help him to understand that field, you know. So this is what mentoring can do for people to decide which direction they want to go. Another problem is, for example, I mean, all over the world, women are not very seen in large numbers in surgical fields. So why is that so? The real problem is that when they are students, they are not exposed and mentored in the surgical branches. It is just assumed by them as well as whoever is teaching them that they are going to be either going to obstetric and gynec or pediatrics and perhaps to anesthesia. And they are unlikely to take to surgical fields. But the real thing is that if mentoring is more widespread, you will find an equal number of women might be interested in orthopedics as are men. Right now, the worldwide figures are not very impressive. There's only about 7% of the women who are practicing surgeons and only 14% who are residents. This is 2013 figures. So things are improving, but mentoring, I feel, has a big role in providing not only information, but curated information and also information that will improve that person's knowledge and his competence. They they also found that one study was done on YouTube. No, one study was done about hospitals, how hospitals use social media. So hospitals are using social media for supplying information to a general audience, 97%, providing content about their hospital itself, 93%, announcing news and events, 91%, public relations, 89%, and promoting health, 90%. There are some very good hospitals or very big hospitals who have interactive mechanisms. You can ask them questions about anything, about any operation, anything that you want to know. And those are quite useful. But right now, most hospitals are using their websites and social media for promoting themselves rather than promoting health or promoting knowledge.
So this was about mentoring.
Yeah.
We didn't, I mean, when we are speaking about online social networking apps, we haven't spoken about WhatsApp, the most used and the most accessible, the most easy to use, user-friendly app. Is it of any use other than just sharing the links and forwarding the images? Do you believe making relative WhatsApp groups of specialties, subspecialties?
No, what I am amazed at and what I am really, I feel that we haven't understood enough and we are not grateful enough as to how the WhatsApp technology has improved our patient care. For example, when I was a resident and I had to convey information to my consultant in the emergency, I could not show him the X-ray. I had to just tell him, sir, patient has got this problem. I have taken the X-ray showing this, so what should I do? Whereas now, the technology is allowing me to share the patient's findings if required, the patient's vital information about his general condition and all that, and whatever investigations have been done. So my senior is able to, he knows almost as much as the resident in terms of input. And that allows a much better quality of intervention or planning because it happens instantly. There is no time lag. So the moment a casualty comes in or an emergency patient comes in and you have completed his investigations, instantly you share that information with whoever else needs to know that. And the advice and the mechanisms are instantly told, do this, do this, do this, do that, and be ready with this. I have found that patients of fracture neck femur are being operated within 1 hour of their entering into a hospital, within 1 hour. So this is the kind of efficiency that we are able to achieve with this WhatsApp group technology. Because all the findings are shared with anesthetists. The anesthetist also comes prepared. And, so this specialist treatment team and the sharing of information has made a huge uh, uh, progress in terms of improving the efficiency and the quality of care. Now, there is also another thing that the mobile camera allows us to do so many things that we were not able to do in the past. Like, suppose you are seeing a patient at follow-up and you want to record his range of movements. You used to write down 30 degrees to 70 degrees. Now you have a video record which you can access at any time to confirm and show the patient and keep it for your medical legal purposes so that you have evidence as to how the patient was progressing. At the same time, you have some ways in which you can transmit information that is specifically needed to a patient. Because, like, for example, you see a patient and you realize that he needs a certain type of exercise to produce a certain type of improvement. Now, in the old days, we had to explain to him what was that exercise. We had to give him a pamphlet of what it was, or we had to write down and draw figures to explain. Now we just tell him, okay, you go home by in another 2 hours. You will get my prescription and a link to the site where you will get that specific exercise, where it will be explained properly by an expert, and a video will be there which you can see multiple times, and you can just put it and copy that video when you're doing the exercise. Now this is where technology scores and makes things more user friendly. And I cannot underestimate the importance of user friendly. Most of the things today in life are not possible only because they are not user-friendly. They are more complex. So anything that is user-friendly is going to make a big difference to the user. Now, the only problem with this whole WhatsApp information, so I'm not even talking about using WhatsApp as a tool for training and sharing information. And you can, like you may not be in the operation theater, but if I'm doing an operation and if I have the proper technology, I could 100 different people who are being mentored by me can be invited to see the operation, and they can actually see what is being done, and they can ask questions and they can get information. So the quality of this as a tool for training is cannot be overemphasized. The only problem, if one has to say, is that all this cannot become part of the patient record for very obvious reasons. And to have access to this world, you need to have internet connectivity. Now, I know that in India today and in a large city like Pune, you don't really feel that connectivity is an issue. But it is still an issue in many parts of the rural parts of the world. All over the world, it's a problem. And also, we have to understand that not everybody has very highly powered, phones and so on. So the quality of the use of the technology depends on what kind of gadgets you have and what kind of environment you have. If you have an internet friendly environment, and if you have good quality phones or gadgets that can be used, then you are as good as anybody anywhere in the world. That's how the democratic this whole technology has become, has made. You can access what is happening in Harvard Medical School in a certain operation theater on a given day, and vice versa. One small thing I want to tell you is about the use of this technology for helping doctors and patients who are not accessible to you because they are staying far away and they are remote. So they use this in South Africa, and they found that in South Africa, in the rural areas, there are no orthopedic surgeons. So there are only doctors who are like what we call BAMS or, not even properly qualified. They are certainly not orthopedic doctors. They may be general practitioners. So they did a study that they asked 72 doctors. They asked all the doctors to, they gave them a site. They said, any orthopedic problem that you have, you just post it to us. And they formed a 5-member group that will respond. So they posted 731 cases over a 6-month period. So almost one case per day. Out of which 90% of the cases, the orthopedic team responded to the doctor in the remote area within 1 hour. In 48% of the patients, they were treated successfully at that point only by the team. Because the doctors could say, "Arey, don't worry, this is like this is what you do, and it will be all right." Like that. Because that fear is there now, because you don't know what it is. So 48% patients were treated at the site and they could go home because they were actually effectively seen and managed by an expert orthopedic surgeon through somebody else. Then 39% were treated by an orthopedic surgeon at a peripheral level in small hospitals. And only 12% were referred to or had to reach an orthopedic specialist in a level 3 hospital. So you can imagine how much of anxiety, how much of cost saving there would be if a team of orthopedic experts could provide their knowledge and experience at the grassroots level, and how much everybody will be benefiting. Right now, the question to ask is, are we doing it? The question to ask is, are we not doing it because there's no money in it? So we have to find ways of these around these. We have to find answers for this, and we have to understand that we cannot sit in ivory towers, and we cannot say that, okay, I'll treat only somebody who will come to me, and I will treat only those with difficult problems. If I can treat more patients, and if I can treat patients by even advising somebody what to do over a long distance and remotely, provided I'm paid a little bit, provided the system allows some remuneration. So these are challenges. We have to look at these things and see how we can use the technology. See, because the world, the patients, the public, what they want. They don't care about technology in that sense. They don't, unless they see the technology helping them and solving their problems without spending too much money. See, today, why is the cell phone become so useful all over the world? Is because it has become cost effective. It can be afforded by people who are poor, and it gives them a tool to talk to people whom they care about. So it's an emotional thing. It is not, and that makes people feel good about themselves. So technology, if it is completely indifferent to the individual's emotional, social needs, it is not going to be as useful as if people who understand, people who are good, use it to um, to better the lives of people and make them access the best and the brightest information and knowledge and technology. So in the remote areas, if there is a patient who has a complicated problem, certainly he should come to he will come to the larger hospitals. And if the patient is not having the means to pay for his treatment, mechanisms can be developed to see that the best possible treatment can still be provided to him. So I just wanted to bring out this aspect of technology, particularly of the social media, as a tool for doing good in the world also.
Absolutely, sir. Wonderful insights you shared, very extensive as well. And it is not just about some social media apps. We digged into the tech, like you mentioned, the technology of social media and how we can make use of that. So now
I'd like Ashok Shyam to tell us about these virtual health communities.
Yes,
because that is an area which he has really been a pioneer in. And it is a completely limitless area for development.
Because
yeah,
when we speak about virtual health community, what just two words cross my mind, that is WhoMedi and OrthoTV. And very proudly we say that now that OrthoTV, we have the founder of the OrthoTV and with us today, and it is an Indian which is going global. So that is again a thing to be proud of. So
absolutely, I agree with you.
Yeah, so no one needs, I don't need to start with an opening note or an introduction. So Ashok, over to you, Ashok Shyam sir.
So thanks a lot, and I've been listening to the conversation for nearly 90 minutes now. And we spoke about a lot of aspects and a lot of things. A question put to me is about virtual communities. And many of you may not know that IORG as a community on virtual platform was started way back in 2008.
Yeah.
When Facebook was just 3 years old,
Yeah.
we started the Facebook group there as a virtual community for orthopedic surgeons, one of the first ones to be started in orthopedics. And the idea was same that I like discussed here, to communicate our experiences to each other and to learn from that.
Yeah.
So I think the basic role of most of these virtual communities has remained the same. Technology has expanded to make it more and more accessible, easily accessible, as well as fast. So WhatsApp is much faster than Facebook. Now, Instagram is also growing in that aspect. But I think for discussion groups, Facebook and WhatsApp are still very good. We also have Telegram as micro communities. So, like I told you, Facebook was started as a huge community in 2008.
Yeah.
But then we realized that there is a need for specialized community which are smaller. And
Yeah.
that is how in 2016, we started with smaller specialized groups on WhatsApp.
Yeah.
And that is where the discussion takes place. I mean, a lot of discussion takes place in a lot of these groups. We nearly have more than 300 of these WhatsApp groups with me. So it's like a huge network where a lot of things keep on happening almost every day. So I think it is a very good resource for a lot of surgeons, especially in periphery, who can learn from experiences of each other. And it's going to stay here, but maybe the format and the technology keeps on changing. So yeah, that's my view.
See, one thing that has impressed me, Dr. Ashok, when I look at the conversations that happen in these communities, is that people who are part of that community are, in a sense, forced to become knowledgeable, because the conversation will become meaningless unless they know the subject.
Absolutely.
And so somebody who is just not familiar with the subject, if he joins the conversation, he will not understand what is happening. So the being a part of the community requires you to read and to familiarize and to become knowledgeable, without which, and once you reach that level of knowledge, then only you will start enjoying the conversations and the material that is available. And it is then a win-win for everyone. If people
Absolutely.
who are practicing remotely and who do not have a lot of advanced knowledge, they will find joining these specialized groups not very useful. They would be better off if they use the mechanism that I spoke of in South Africa, where they use a group of a known group of experts as a platform where they put their problem and try to get the advice that they want. So they don't have to do a lot of uh, educating themselves as a prerequisite to understanding what is happening.
Right.
So have you tried this experiment of what I talked about in South Africa, where
Mm,
you use a group of doctors
yes.
on a continuing basis online service to a remote community of doctors who are not very familiar and not very do not have the resources to give specialized treatment?
No, we haven't yet tried as giving it as a specialized service as such. It's a
Okay.
good concept, but I think most people joining, especially in Facebook group, are from all across the world, and especially even from Middle East and Africa. So they are benefiting from the conversation. They are also putting up their cases and asking for opinions. So in a way, it's happening, but we don't have a formal editorial board or a specialized board who will answer that. Anybody from the group can answer.
So they would also have to be one thing that comes to my mind is that with these specialized groups, it is necessary that suppose you have a specialized group of, say, arthroscopy, for example,
Yes.
then that group would be well advised to put in the public domain or in the domain of that group what we call as clinical practice guidelines, which will be updated from time to time, so that at any point anybody joining the group and wanting to learn about the basic information that he needs to know to understand and appreciate the conversations and the specialized tools that are put in and all that. So do you think that is happening, or there is any thoughts on this?
So there have been few apps in the past who have done that, but they have seen a period of growth, they have seen a period of stabilization, and then they slowly saw people moving away and have died down a natural death. So I don't know if an independent portal can sustain that. While a shared portal like Facebook or WhatsApp can very well sustain it. Yeah.
See, like I am in a group like this, okay, and I am saying something that is um, specialized. Now, I am asked a question by one of the participants, which makes me realize that he doesn't know the basic guidelines or the this thing. So now, how do I say that? Where do I direct him to uh, to get that information? Because this is
I
a
think
common problem.
I think most of these basics are already covered in videos on OrthoTV, and they can simply direct them to their own videos, the experts. Most of the experts have taken a lot of talks on basics and advanced also on OrthoTV, and most of them are there. They can just share the link and ask the person to view it, and then based on those, they can ask queries to him because it's his own talk.
Okay, so what you're saying is the information exists. The
Yes,
information is not in a very organized manner at the moment,
yes,
and it is not accessible like to general users in the sense that you open a textbook and open a certain chapter and you get certain information. So you know it's going to be there,
yes,
whereas now we have probably more than necessary information by multiple sources.
yes.
So it becomes sometimes a little confusing. So it is necessary for the larger associations to make this a standard feature of their work to create those, like AAOS is doing it. They are doing it, at least the Orthopedic Trauma Association is doing it. They have set up clinical practice guidelines for entire trauma, and they keep curating them and upgrading them. And that is available to the entire orthopedic community free of cost. So those are the kind of initiatives that one would expect to happen. And it need not be a specific surgeon and a specific type of information that is there all the time. Because that makes it, see, the more you complicate the use of technology, the more unhappy it makes people. The more you simplify it and the more easily you make it available.
Available, yeah.
Yeah.
No, that is the case in all aspects. The more user friendly, the easier it is. More attention grabbing it will be.
Yes.
For example, I mean, I'm just saying this, Ashok. I'm instigating you, perhaps, but I'm saying that you have this Telegram sites where you keep providing people with educational material like books and this and that and all that. Now, uh, is there a way in which I can go there and uh, say that, okay, what do you want information on what? and is it a book or is it something this thing? And I just submit it, and I know that within a certain period, like 2 or 3 days, I will get the advice and information and so on. So is that that is not happening right now?
It cannot happen with free portals doing a work on, say, I mean, it's a free portal. We do it on our interest and based on our time available. If somebody asks us a question on, we want literature on triple orthodesis, it then falls on me to do a literature review and find out the best articles. Those are time-consuming things. I don't think we
No,
have
but what if that service were to be made available on payment?
I mean, it's a what if. It's a big what if. Of course, if it is available, it is good for all of us. Many times, even I am searching for articles and things. It can be provided. I'll be happy to pay for it, but it's difficult to provide that currently.
Yeah, but that is precisely where a startup is born, because you already are convinced that there is a need, and you already know
for that, because our especially in India, our universities and colleges have failed to provide access to literature in any form. No access to journals, no access to books. Books very limited, but journals also very limited, but very few colleges provide it. University, none of them have a centralized library where orthopedics journals are available and given to us. So it becomes really difficult.
So that means that the potential for a startup, which will for a affordable fee give you access to
No, there is another
information.
party involved in it, which is the publishing houses. So the affordability becomes difficult once the publishing houses come into it. Because then they are like, why don't you subscribe to our up to date or something they are already making available?
Yeah, okay. I mean, what I'm saying is that.
But I think we this has gone beyond the purview of today's topic.
Okay.
So this is our own discussion when we meet next time.
Sure.
Okay.
Yeah.
Thank you.
So on an ending note, it is let me mention again about OrthoTV. It is only and only because more than a decade back, the idea was struck to Dr. Ashok Shyam sir, and it is only because of that this our meet is been relayed on n number of platforms like Facebook and probably YouTube and on Club Radio as well.
Yes.
So that is what you call a very effective, judicious, and an ethical use of social media in medical fraternity. So that's all for today. We have
Thank you.
Talk.